why does chemotherapy cause constipation and diarrhea and abdominal pains and just general nastiness for your GI tract? Well, chemotherapy attacks cells that are kind of dividing and growing, forming new cells. And the lining of our GI tract, which sort of starts at your mouth and goes right down to the other end, it's like being replenished all the time, right? Because, I mean, you're eating food that's scraping off cells, and yeah, you need new cells growing and replacing them. And you think about it, your intestines or whatever deal with quite a lot. I mean, so so does your sort of your esophagus. You might be drinking hot drinks. Yeah, spicy foods, just rough foods, bits of sharp stuff. So yeah, it's really important that those cells are being replenished all the time. So they're continually being like scraped off and replaced by new cells. And unfortunately, the way chemotherapy works is it attacks growing cells, dividing cells, cells that are in that four-step cell cycle that we presumably learned about at school. So yeah, it's one of the most distressing side effects, I guess, or family of side effects, really, the family of gastrointestinal side effects. So abdominal pain, kind of gas building up in your stomach, frequent diarrhea or long periods of constipation. It's very, very unpleasant. A kind of a more serious thing related to diarrhea is that a lot of chemotherapy causes damage to your immune system, suppressing the immune system. So you're very open to infections. So a classic example is there's a chemotherapy called irinotecan, and it often causes something called C. diff, which is it's just a type of bacterium that is, I think it's probably one of those ones where everyone's got a little bit in your body, but your immune system keeps it at bay. And if you're taking this drug, irinotecan, the C. diff, is able to like thrive in your weakened immune system. And it's a very, very unpleasant bacterial infection in the stomach that takes weeks of antibiotics to get rid of, and then you frequently have a recurrence. And yeah, it's not nice. The antibiotics are strong and cause abdominal pains. So it's really, really important to get on top of these side effects because they can be dose limiting, which means like if the side effects are bad, you're going to have a reduced dose of chemo or chemo breaks, and that may give the cancer a chance to grow, spread, or whatever. So with side effects, it's really important to report them early, report them repeatedly, be very specific, keep a diary. Just whenever you're seeing the nurses or your oncologist, tell them about the side effects, ask what treatment's available, ask how the side effects can be reduced. Certain drugs you can reduce the dose and still get good benefit. So that may be a way to reduce the GI side effects. Maybe other drugs you can have along with it. It may be useful to eat certain foods before the chemo. So I guess the kind of foods you'd eat with an upset stomach, like bread. There's the classic. Is it the bran thing of bread, rice? Oh no, so yeah, bread, rice, applesauce, Not sure what the M stands for, or the N. But anything that's going to absorb water, that's going to maybe help with a bit with the diarrhea. If you're given anti-vomit drugs with strict instructions, follow the instructions. So some anti-vomit drugs come as a set where you take one the day before the chemo, one a day, chemo one the day after, that kind of thing. Yeah, chemotherapy causes gastrointestinal issues because the cells in your gastrointestinal tract, the GI tract, they're being replenished all the time. Chemotherapy attacks cells that are being replenished and replaced. Replaced is probably a better way of putting it than replenished. So unfortunately, that means chemo is going to attack your GI tract. And get on top of the side effects, manage them, keep discussing them with the people who are treating you, because reducing their side effects is going to be a really important thing to allow you to continue with the treatment and hopefully get an excellent treatment result and be able to stop the treatment. So I hope that's helpful. If you have any questions about gastrointestinal side effects, please post them below. Any comments, any advice, or just anything you found useful in this video, please post it below. Thanks a lot.